Marlon, can I have your pen? We're recording. Okay. Good evening, everyone. It is June. Okay. Okay, perfect. Good evening, everyone. In the PowerPoint. It is June 9th at 7:04 p.m. and we are holding a public forum on the home ARP allocation plan for the city of Mount Vernon. And I have a PowerPoint presentation that I'm going to be quickly going over. This is being recorded, will be live streamed and posted on our website, and it will be part of the official record of what is submitted to HUD. And we plan to submit the draft plan in July. So the cities, I'd like to welcome everyone. I'd also like to acknowledge that the mayor of Mount Vernon, Mayor Sean Patterson Howard, is here with us this evening. Thank you, Mayor, for being here. So on the agenda items quickly, I'm going to just go over, provide ESG CV updates, talk about the home ARP draft plan. If there are any public comments that that the folks who are in the room would like to provide, that they're welcome to do so, and any questions that are asked. So our ESG CV updates are as follows. The city had received 1.8 million. Next slide, of 2020, $1.8 million. For fiscal year 20 and 21, we had received an annual allocation of $145,000. For fiscal year 2022, our ESG status has changed. The formula requires that jurisdictions that have to receive 0.5% or more, and we were allocated less than 0.5%. So the funds we would normally receive are going to be reallocated to the state of New York. So we have 5 different program components. Next slide, slide 5. We had several program components, and I would like to provide an update on street, slide 5. On street outreach, there have been 105 homeless individuals that have been connected to resources or placed at emergency shelters since the beginning of the program. On rapid rehousing, we had the street outreach team connect those who are living in our streets with housing. And to date, we had provided housing to 12 homeless clients. Are you here for the home ARP? There you go. Yes, welcome. Yes. I mentioned you pre-pandemic. Westchester Disabled. Oh, wonderful. Thank you for coming. So in terms of the rapid rehousing program, we have provided housing to 12 homeless clients to date. Slide 6. And then for youth who are under the age of 24 who are homeless in the city of Mount Vernon, to date, there are 14 youth who we have provided rental assistance to and are continuing to do so for them and their families. We've also allocated funding, next slide, for domestic violence survivors. So to date, under the rapid rehousing program, we have 7 individuals that have been selected. 4 of them have received emergency housing vouchers, and 3 of them are on the waiting list. And this is incredibly important because not only are we paying their rental subsidy, but we're also ensuring that through the case management team that applications were submitted to the state of New York for them to receive rental subsidies for 9 years. So that will go a long way to helping them create housing stability. And then for individuals who are fleeing domestic violence, who are not staying at emergency shelters, but in other places, there are 7 individuals that we've been serving. 3 of them have been placed for, have been accepted for the emergency housing voucher program, and 4 have applied and are on the waiting list. So again, I'm really proud of the work we've done around the domestic violence program to help create housing stability for those individuals and their families. Next slide. So under the Home American Rescue Plan, $5 billion had been allocated by the federal government to address homeless assistance to vulnerable populations. Next slide. And there are 4 eligible activities: affordable rental housing, tenant-based rental assistance, supportive services, and the purchase or development of emergency shelters. And in the 2021 annual action plan, the city indicated that it's considering allocating home ARP funds for tenant-based rental assistance and have these funds available to place individuals and or households that may need this resource once the ESG CV grant funds expire or are fully expended. We anticipate fully expending our ESG funds by September of 2022. Hence, that's why we've also worked to ensure that we put together a draft home ARP plan, because depending on public comments, what we'd like to do is roll over the individuals who are currently receiving these resources who may not be self-sufficient by then, and for them to continue receiving assistance. Based on, one of the things we need to do is on our needs assessment, we need to show what the data shows. And based on what we have seen, we see that there are lots of renters facing housing instability in the city. There are approximately 25% of the city faces housing instability. That is what the data shows in our home ARP draft plan. So what we're trying to do as we transition households to the home ARP program is we're trying to address 2 challenges. Slide 10. We are serving people who are recently homeless, and we're providing assistance to renter households who are extremely low income and are considered at greatest risk of housing instability. So those data points are on page 11 of the home ARP plan. So basically what we're saying is those individuals who are at risk of, because of their annual income limits, because of the economic fallout, because of the challenges of trying to find jobs, there is this population that's paying more than 30% of their annual salary, and it's more like 50 to 60%. They are at risk of homelessness. And the individuals who we're helping with ESG CV are recently homeless. And if we don't continue providing those supportive services and rent assistance, they may become homeless again. So they would be part of that makeup. On page 11, we have our proposed budget. So supportive services about 290,000. So that is job training, legal services, childcare, a whole host of things that can be used to ensure that not only are we paying for housing, but we're out doing all we can to ensure that people are self-sufficient by the time these funds are expended. And then 1.1 million for rental assistance. So we're looking at providing anywhere between 20 and 30 individuals with rent assistance for a 2-year period. And then funds are being set aside for case management, for whoever we partner with to hire staff and train staff. And then the city would keep the admin funds, because there's a huge compliance piece to all of this. It is a lot of work. And so we need to make sure that we're able to cover the staff costs of this as well. Next slide. So I'm going to go towards the end of my presentation. Actually, go to slide 16 for a moment. And that shows, and this is also going to be posted on the website tomorrow, www.cmv.com/URA. And it gives you a sense of some of the eligible costs for supportive services that we would be looking to cover. And so we are trying to be innovative and address as many of the community needs as possible. And then towards the end, I'm going to go towards the end of the PowerPoint presentation, slide 22. And it talks about the requirements. So we had a public hearing, which was virtual on January 3rd. We had June 3rd, and we're having an in-person public meeting. We also coordinated with the COC, the City of New Rochelle, the City of Yonkers, to do a virtual public meeting that was held on January 11th. So we tried and worked very hard to ensure that we have transparency and that to seek as much input as possible. And then the last slide, Marlon, slide 23. So our projected timeline, so as I said, we had a public forum January 11th. We released our draft plan May 16th. We're one of the first jurisdictions in the New York, New Jersey area to submit their plan. We'll be one of the first ones. We have submitted it to HUD as an early draft for public comment to get their feedback to see if we're meeting all of the regulatory requirements. The public comment period is going to officially close June 17th, and we plan to submit our draft plan on July 1st. So based on any written comments that we have received during the virtual meetings, any we received today will be part of what is included as part of the official record. So with that, I'm going to open it up for any questions in the room, any public comments. Mayor, would you like to say a few words?
So, clearly we understand that homelessness and the increased risk for homelessness has always been a problem, but has increased during COVID with people losing work, with businesses being closed. Now we're dealing with inflation and other challenges. We know that it's been difficult. We know that not just housing, to provide housing is the important thing, but the supportive services are just as important. And right now, we know our unemployment rate across the nation is about 3%. And as I was walking through the community yesterday and talking to a lot of our small businesses, many of them are looking for employees. They're looking for people to come work with them, our restaurants, different tech companies. And so reskilling and upskilling our residents is going to be very important. Also really working with our residents around customer service is going to be important, because we don't want to just help people get a job. We want them to really maintain their job. And so providing the housing assistance is important, but the supportive services like job training, child care assistance, mental health, substance abuse services, those are equally important because they help people maintain their stability in both housing as well as in employment. So, I just want to thank you for continuously putting the information out there. The Guidance Center has done outreach to over 105 individuals on the street, providing them with services. A lot of people say, well, why are homeless outside? Homelessness is not a crime. So if people are homeless, there are some that want to go to shelters, there are some that want housing, and there are some that are not ready to deal with a shelter system. People say, well, why wouldn't anyone want shelter? Well, in order to go into a lot of the shelters and housing, you have to give up your Social Security or your DSS benefits to a certain extent, and people do not want to give up their personal or their earned money. Some of the other things are restrictions. You have curfews. There are rules that you have to follow. And oftentimes mental health is connected to quite a few people's homelessness. And so, dealing with paranoia, being around a lot of people, not feeling as if you're in control of your environment, those things kick in. Substance abuse kicks in because you can't use substances and stay in the shelters as well. So, those are some of the challenges that we face. And while some people say, well, to see them on the street is a nuisance, again, it's not illegal. Homelessness is not illegal. We cannot make people go into hospitals. We cannot make people go into homeless shelters, and we definitely cannot imprison people for being homeless. And so we continue to work with them, to engage with them, build trust, continue to try and get the supportive services that they will accept until such a time that they are ready to accept housing. And the outreach and having them as part of the HMIS system, which is the Homeless Management Information System, which helps us to continuously identify where they are, where they're moving, their chronic homeless condition, which helps to make them eligible for housing and emergency assistance. We have to meet people where they are until they are ready to go where we would desire for them to go. And I know that's a hard thing for people to understand. And then some of the people that we see on the street are not homeless. They just like to congregate publicly and hang out with their friends and relax. So, people say Hubcap Park or Wino Park. 90% of the people who hang there are not homeless. They are housed, they live with their families, they live by themselves. A lot of the people that you see that hang out on Prospect Avenue, they're not always homeless. They are people who, again, they meet with their friends and family. If you're living with your friends and family and you're living in the living room and you can't have people come hang out with you, you go and you hang out with your folks on the park, in the park on the block. And so the people who are homeless, we are absolutely engaging them and providing them with services until such a time that they're ready to be housed. With our rapid rehousing program, we have met our goals. We've actually exceeded them, so we're about 105%. With homeless prevention, we are at 140% of our goals. The domestic violence program, we've met them, and we've even gotten people EHV.
Yeah.
So we're providing the families with housing and housing subsidies, and the emergency housing vouchers that they've received are good for up to
9 years.
nine years. And so they should be housing stabilized for 9 years as long as they're paying their portion or based on the formula. The domestic violence rapid rehousing program, okay, there's the domestic violence rapid rehousing program and the domestic violence prevention program. So that's for people who have not lost their homes, but we're trying to maintain them in their homes, so that prevention.
So there are people who are couch surfing, who don't want to stay at a shelter.
Mhm.
So these are for individuals who don't want to stay at a shelter or couch surfing,
We're helping to stabilize
They're
them,
housing.
and we've been able to get 3 of them emergency housing vouchers, which will provide them with stable housing for up to 9 years. And then 4 of them are still waiting on their emergency housing vouchers to be approved. But the process has been started and completed with the assistance of case management. I know that we've done also the work with our youth.
Yes, so
Yes.
there are 14 youth who have been placed in
And their
housing
families.
and their families.
And that's the 140%. I think I just said with our with our homeless prevention, but I didn't explain that that was the youth program. So our target was 10 youth, to house 10 youth in their family. We've been able to house 14 youth in their families by working with the school district, by working with the youth shelter of Westchester. And so we are making inroads. People think 1.8 million or a few $100,000 is a lot. It's not as much as you think once you start paying a few $1,000s a month for rent, and you're also paying for the case management and the job training services. But we are trying to use our money as wisely as possible.
Yeah.
I'm sure there are some people saying, well, why don't you take the money and build a building? $1.8 million does not build or renovate a building at all. And we have a lot of people who are at risk of homelessness now. And even if we built a building quick, it could take, going through land use and going through building and all of those processes, it can still take, 2 years to build a building. And so what do we do with the families who are in very precarious situations right now? And so that's why we have chosen tenant-based rental assistance, so that people can choose where they want to live and we can support them, instead of just picking also one building and making that building overwhelmed with people who have challenges. We don't want to overwhelm any one building with people who have special needs. And so we want to make sure that there is what we call scattered sites housing that has been shown to work better, as well as it helps to stabilize the family, as well as it doesn't destabilize the neighborhood. So thank you.
Scattered sites.
Scattered sites, meaning we're not just putting people in all one site. Yeah,
Yeah.
scattered sites housing.
And we're running some of the most innovative programming out there right now because we are addressing the needs of individuals fleeing domestic violence, youth who are homeless in our community. We have a very high youth homelessness in the city. And so we are also, we've also been doing innovative programming in terms of having our street outreach team and help to, and, to identify those who are unsheltered and provide them with rapid rehousing. So this is some of the most innovative programming out there. And I'm really proud to say that we're doing this in the city. There's no one else who's really doing it in the immediate area. So, and this is a result of feedback we received from the community, from the school district, from the Children's Association, from other organizations around the county. So know that when you provide input, we listen and we respond, and we've done that. So thank you to everyone who's actually provided input, because we have designed our programs as a result of the input that we received.
And I think the other important thing to say is you have to meet timeliness tests. One of the things that the federal government said is they did not want to see money just sitting in the bank. They wanted to send the money to communities, and communities get the money out to people who needed them most. And so that is what we are doing. We are turning this money around, and we're making sure that individuals and families are being stabilized, as soon as possible. We do not want to have to send money back to the federal government because we have not used it in a timely manner. And so we are meeting our benchmarks with that. And we are happy for that. And the people are being served. Like I said, we've exceeded our numbers. We know that there's more people that need help, and we will continue to work with them to help them directly, as well as do referrals and help partner them with other organizations. I know as people look at the proposed home ARP budget, they might say, well, 290,000 in supportive services, that just goes, that's really focused on the people that we're helping to house, correct? We have supportive services agencies all over. This is just our extra part.
Right.
We're not saying that 290,000 is going to cover everyone in the city for supportive services. There are a lot of agencies that are in place. We are just providing additional monies to them. Mount Vernon, the city has a budget, but there are 40 community-based agencies that are providing supportive services on different levels and have different budgets. And this is just additional monies that are going into that pot.
And to that point, the COC and the guidance center is in the room. The COC had a meeting last week, and we talked about job training programs, because we need to do more to help people with job training programs so that they are self-sufficient. So that is front and center for us here in the city. We are pushing and encouraging our counterparts in the county and in the other jurisdictions to partner with us around job training programs so that we can do as much as we can to ensure that people are self-sufficient, right? Because we want people to live with dignity. We want people to be able to provide for their families, and people want to do that as well. So let's meet them where they are, and let's identify really good job training programs, and let's do that. And the mayor is also really, really focused on this as well. So we're looking at other funding streams to do job training programs as well.
Are you working with Access VR and your state commission compliance? Well, the guidance center actually has the article being.
So the question is, if we were, you're saying the guidance center is working with Access
Here, do you want to
VR.
come on?
So Access VR provides vocational rehabilitation services to individuals with disabilities. And so if there are individuals who are identified, who have sight challenges, who have differently abled sight challenges, or who are blind, visually impaired, right, then absolutely they're eligible. And so if you're representing that population, we'd be very, happy if there are individuals who you
Absolutely.
are aware of that need assistance to give them guidance and direction. Because
That's what they usually overlook when it comes to these huge programs. But
So we have Westchester Disabled on the Move in the room, and thank you for being here. We do want to partner with you and continue that partnership. So absolutely, we will look to make sure that as we have these conversations, you're also in the room with us.
I appreciate that.
we are always trying to expand our tent. And so, as we identify, or our partners identify us, we want to bring them in and make sure that none of the populations are being left out of the equation.
Did you get my input? I don't know if you received it or not. I can send it my email. Whoever I copied and pasted.
Let's talk afterwards because I haven't seen it. And so I want to make sure I receive it. So it's part of the official record. So whatever public comments Westchester Disabled on the Move has, we would welcome those. And we will include that as part of the official record. And then, did you want to say anything else up here or? So Guidance Center, do you want to say anything about the street outreach and the 105 folks?
Well, we just want to make sure it's on the record.
It's on the record.
So I'm Alicia Lori Gratian, and I'm part of the Guidance Center of Westchester. And we're collaborating with the City of Mount Vernon. We've been providing services to.
We just want to make sure you're speaking in the mic so that
We've
it
been
picked up by the live
providing
stream.
services to the City of Mount Vernon for many years and have a lot of experience with homelessness. And we found that the City of Mount Vernon has a large population of homeless and is really in need of these funding. And we have seen an increase with, COVID and everything that's going on in this world, and people are losing their jobs and a lot of evictions. And so our street outreach, we have one of our street outreach workers here, if you want to say anything, but Eric Hall, he's here, and he could vouch for the amount of homeless that we see in the city of Mount Vernon. We have assisted 105 to this date, and there's more every week of homeless that we are engaging with and offering services, offering shelters, trying to help them gain housing. Since the Guidance Center also has other services, we do try to help with mental health, substance abuse services as well, vocational services. As you said, we do have an Access VR contract as well. So we are really in favor of this, the home ARP, because this is really amazing. The plan that you've put together helps with these wraparound services. And you could give somebody an apartment and they could lose it right within a month if they don't have the support. So this is really wonderful that you have the additional support and that you're going to provide education as well and help people grow and be self-sufficient, because that's really where where things happen in people, and it's going to work. We don't want to just house people and then have them homeless again and just going through the system over and over. So this is wonderful. I don't know if Eric, if you want to say a few words.
So good evening, pardon my back. So I just joined in February of this year, but it's been an eye-opening and challenging situation. Number one, to be told that there are homeless people in Mount Vernon, and then you drive around Mount Vernon and you don't initially see it till you get out and you start walking around and talking to people. Like the mayor said, there are people that just come outside to hang out. They're drinking, they're hanging out, they're having a great time. There were 30 people on the wall yesterday, literally, just standing there. And I wait for buses to go by, nobody gets on them. But there are homeless people out there. I'm working with one client now who is living out of her car for the past 2 years. So you have to find them. They're out there, and these people, like the mayor said again, they don't trust shelters. They don't trust drop-in centers. It's all about, I've had a bad experience. I don't want to put my name in the system. I may not want the help. And who are you? You work for the Guidance Center? What does that mean? So you have to develop that trust. And since February, I've developed some trust. Some people still see me every day, talk to me every day. I've been working with a woman for the last 2 months who just gave me her name, her first name. So it's all about developing trust. So they're out there and I'm out here to help. That's basically it.
Any other comments? Anyone else want to ask questions? Yes, ma'am. Good evening.
My name is Ramona Parker. I'm a social worker with Mount Vernon City School District. I specifically am what you call a McKinney-Vento liaison. There are two of us in the city. Normally, most school districts have one or half a person. Due to our number of homeless students, Mount Vernon City School District has two. So I just want to say, our experience working with the city, we are so grateful that the city had reached out to us and offered to be of assistance to us, knowing the challenges that we face with homeless students. And yes, you know, you've helped many of our unaccompanied youth. We've had families who have been assisted through the guidance center, through the ARP funding. So I'm sorry, the emergency funding. So we appreciate that. I think you mentioned a timeline for when you're actually going to start, but I missed it, for the rental assistance, the 2-year rental assistance that will be available.
So we're submitting the plan to HUD
Okay.
July 1, and then we're going to wait to hear back from them to see if they approve the plan. But
Okay.
we would like to roll over those clients under the ESGCV program into the home ARP.
Okay, so we know that in the city of Mount Vernon, through the school district, our experience is that many of our McKinney-Vento students, our homeless students, are families who are in inadequate housing. And so we know, and I think you did talk about the fact that in the city of Mount Vernon, we do have a pretty large population of families or individuals who are in inadequate housing. And I know the city has started through the planning department to address some of these issues through the buildings department. And so I think, you know, everybody, you're on the right track, definitely. But it is it is a huge issue because it does precipitate homelessness. We have, you know, so many of our families who that is how they become homeless. Many of our families do avoid going into the shelter systems, so they'll double up. We know that the county, if you're doubled up, will not serve you as homeless. So the funding that you have received is like, it's crucial. It's just so important. And so the fact that you've attained this funding and you're using it to serve those persons who are not just in shelters, but are doubled up or who are street homeless is, you know, is commendable. So thank you. And we look forward to continuing to serve the population. So.
Absolutely. And so I'd like to say something to Ms. Parker. I just want you to know, I heard you. And I heard you when you came to us and said, we have a homeless problem with our youth. And I heard you when you said, let's partner and work together and do something about it. And it's because of you and your team that we did what we did around the youth homeless program component. So I want to thank you for coming to meet with us, for collaborating with us, because we've never done this before. And you took a leap of faith and we did it together. And we put this program as a result of your input and those of the parents and the community. So thank you for your leadership, your dedication, your commitment, and know that these lives that have been changed, it's been because of you and the people who work with you. Other public comments? Yes? So Westchester Disabled on the Move.
Yes. My name is Maria Samuels. I'm the Executive Director of Westchester Disabled on the Move. And I did submit a paper, you know, explaining what we would like to do with Mount Vernon. And specifically, we're very concerned about housing, of course. One of the number one, other than employment, that people with disabilities need in our county and is not being addressed. So I saw this as an opportunity to reach out to the city of Mount Vernon and ask for assistance with this, but especially for people who need accessible housing. And that really addressed mostly mobility and sensory, because it needs adaptation in the architecture so they can live there. And that requires a special focus because we live in a great county, yes, and they focus a lot on affordable housing. But somehow it always becomes affordable housing is up here and accessibility is an afterthought. It's never really part of the plan. It's just minimally addressed. And we really need to bring it up to very level of affordability and accessibility. Because our population is aging. There's been a big increase in people with disabilities in our county, and I'm sure with Mount Vernon also. So that is something that we can't afford to overlook anymore, even within the homelessness population. I mean, we get stories with people where shelters are not accessible. So they're in their wheelchairs in the street because they don't really have a choice, you know. And so we need to address that. If we're going to house them, we need to think about accessibility also. And supported housing, yes, is important, you know, because there are people with non-visible disabilities who also need assistance if they're going to get into the housing, but also to stay there. You know, it's also very important, and we offer the services such as even getting healthcare insurance, affordable healthcare insurance, which is usually Medicaid. So that would help them in that sense. We have service coordination to help them with that. And we have other services to help them stay in the housing once they're in there, you know. But first we need to have the architecture done so they can get in to their apartments and stay in their apartments and live like everybody else, you know. So I'm hoping that somehow we can work something out to focus on that need that is ever growing in this county. Thank you.
Thank you. And then I'd like to answer some of those questions specifically around housing. The planning department is working on a comprehensive plan. We are in the very early stages of that. We will be having community forums, and when we do, I think it's important for those of you in the room who have provided feedback specifically around housing and the accessibility units and the housing that we need now and in the future to come to those community forums and provide that feedback and those comments so that those can be included as part of the comprehensive plan, because it's about reimagining what our city should look like in the present and in the future. And then Mayor, I don't know if you have any other comments.
No, I think adaptability is very important. I have aging parents. I have a mother who was a polio survivor and has MS. And, you know, I know that we have to go in sometimes and make adjustments to her housing. And I took care of my grandmother from 80 to 93, and we had to make adjustments in our housing. Now, you know, clearly we were able to do that on our own, but not everyone is able to do that for themselves. You know, one of the challenges is we can go in and do units, but we can't necessarily say that those units are going to be accessibility units forever. So if we go in and if someone lives in an apartment, or, you know, if it's an apartment and if someone has those needs now, we can go in and provide those services. But if they choose to move, we can't mandate the owner of that unit to always rent it out in the future to a person who has those special needs, those adaptability needs. And so it'll be really interesting to see if there are places that we might be able to do some real targeted partnerships for. So as those investments are made, those investments can be maintained for now and into the future. That is definitely a consideration. So thank you.
Yeah. So we will be receiving public comments through June 17th. So those can be emailed to me, sbolivar@cmbny.com, sbolivar@cmbny.com. They will then become part of the official record, and we look to submit the plan by July 1st. In the meantime, I'd like to thank everyone who is watching online and those of you who are here in the room today. I also like to thank the mayor for being here with us today. She has a strong commitment to addressing homelessness in our city, and I thank you for being with us here as well today.
Thank you.
We're done. And so if you haven't signed in, please do so, because that will be part of